I started having back pain, mostly leg pain, related to a herniated disc back around the time when I was deployed in Afghanistan. Looking back on the retrospectoscope, I can definitely pick up when I had a few symptoms starting, but you don't really have a choice of thinking, oh, I need to stop and get taken care of, especially when there are wounded coming into you who are on the cliff's edge. You put yourself aside and they come first and foremost. When I came home, over time, that pain started getting a little bit worse. The main thing was this burning pain, feeling like someone was ripping my nerve out of my leg, all from just a little nugget of cartilage pushing against my nerve. It was getting to the point where the disc herniation was getting larger, so there were only a handful of people that I would trust to take this on, given my profession, and Steve was at the top of the list. We tried epidural steroid injections. When that didn't work, we had tried a course of some oral steroids and anti-inflammatories and some physical therapy techniques. So Steve and I talked about going in and taking out that piece of disc material to relieve the pressure on my nerve and get me up and moving faster. Before the surgery, I was not able to sit down. I was not able to sleep through the evening. My wife was getting tired of being around me. My kids were scared of me because of the pain. After the surgery, it was like a light switch had flipped. I didn't have the pain anymore driving down my leg. The surgical incisional pain was very tolerable compared to what I had beforehand. I was back in the operating room seeing patients 2 weeks after the surgery. Steve has an excellent personality. He is calming. He is appropriately uplifting, funny when he needs to be, but he can also be serious when he has to be. But when you're dealing with back pain and kind of symptoms that just don't go away on their own, you do need to have that very flexible personality, which Steve does have. Excellent, professional, and efficient.